Psychiatric medication video. When developing an initial nursing care plan for a male client with a bipolar I disorder, manic episode, Nurse Ron should plan to A. Isolate his gym time. B. Encourage his active participation in unit programs. C. Provide foods, fluids, and rest. D. Discourage his participation in programs. Answer is C. Provide foods, fluids, and rest. Grace is exhibiting withdrawn patterns of behavior. Nurse Johnny is aware that this type of behavior eventually produces a feeling of A. Repression. B. Loneliness. C. Anger. D. Paranoia. Answer is B. Loneliness. One morning a female client on the inpatient psychiatric service complains to Nurse Hazel that she has been waiting for over an hour for someone to accompany her to activities. Nurse Hazel replies to the client, "We're doing the best we can. There are a lot of other people in the unit who need attention too." This statement shows that the nurse's use of A. Defensive behavior. B. Reality reinforcement. C. Limit-setting behavior. D. Impulse control. Answer is A. Defensive behavior. A nursing diagnosis for a male client with a diagnosed multiple personality disorder is chronic low self-esteem, probably related to childhood abuse. The most appropriate short-term client outcome would be A. Verbalizing the need for anxiety medications. B. Recognizing each existing personality. C. Engaging in object-oriented activities. D. Eliminating defense mechanisms and phobia. Answer is B. Recognizing each existing personality. A 25-year-old male is admitted to a mental health facility because of inappropriate behavior. The client has been hearing voices, responding to imaginary companions, and withdrawing to his room for several days at a time. Nurse Monette understands that the withdrawal is a defense against the client's fear of A. Phobia. B. Powerlessness. C. Punishment. D. Rejection. Answer is D. Rejection. When asking the parents about the onset of problems in young client with the diagnosis of schizophrenia, Nurse Linda would expect that they would relate the client's difficulties began in A. Early childhood. B. Late childhood. C. Adolescence. D. Puberty. Answer is C. Adolescence. Jose, who has been hospitalized with schizophrenia, tells Nurse Ron, "My heart has stopped and my veins have turned to glass." Nurse Ron is aware that this is an example of A. Somatic delusions. B. Depersonalization. C. Hypochondriasis. D. Echolalia. Answer is A. Somatic delusions. In recognizing common behaviors exhibited by a male client who has a diagnosis of schizophrenia, Nurse Josie can anticipate A. Slumped posture, pessimistic outlook, and flight of ideas. B. Grandiosity, arrogance, and distractibility. C. Withdrawal, regressed behavior, and lack of social skills. D. Disorientation, forgetfulness, and anxiety. Answer is C. Withdrawal, regressed behavior, and lack of social skills. One morning, Nurse Diane finds a disturbed client curled up in the fetal position in the corner of the day room. The most accurate initial evaluation of the behavior would be that the client is A. Physically ill and experiencing abdominal discomfort. B. Tired and probably did not sleep well last night. C. Attempting to hide from the nurse. D. Feeling more anxious today. Answer is D. Feeling more anxious today. Nurse BEA notices a female client sitting alone in the corner smiling and talking to herself. Realizing that the client is hallucinating, Nurse BEA should A. Invite the client to help decorate the day room. B. Leave the client alone until he stops talking. C. Ask the client why he is smiling and talking. D. Tell the client it is not good for him to talk to himself. Answer is B. Leave the client alone until he stops talking. When being admitted to a mental health facility, a young female adult tells Nurse Mylene that the voices she hears frighten her. Nurse Mylene understands that the client tends to hallucinate more vividly. A. While watching TV. B. During mealtime. C. During group activities. D. After going to bed. Answer is D. After going to bed. Nurse John recognizes that paranoid delusions usually are related to the defense mechanism of A. Projection. B. Identification. C. Repression. D. Regression. Answer is A. Projection. When planning care for a male client using paranoid ideation, Nurse Jasmine should realize the importance of A. Giving the client difficult tasks to provide stimulation. B. Providing the client with activities in which success can be achieved. C. Removing stress so that the client can relax. D. Not placing any demands on the client. Answer is B. Providing the client with activities in which success can be achieved. Nurse Gary is aware that the defense mechanism commonly used by clients who are alcoholics is A. Displacement. B. Denial. C. Projection. D. Compensation. Answer is B. Denial. Within a few hours of alcohol withdrawal, Nurse John should assess the male client for the presence of A. Disorientation, paranoia, tachycardia. B. Tremors, fever, profuse diaphoresis. C. Irritability, heightened alertness, jerky movements. D. Yawning, anxiety, convulsions. Answer is C. Irritability, heightened alertness, jerky movements. Mr. Marquez reports losing his job, not being able to sleep at night, and feeling upset with his wife. Nurse John responds to the client, "You may want to talk about your employment situation in group today." The nurse is using which therapeutic technique? A. Observations. B. Restating. C. Exploring. D. Focusing. Answer is D. Focusing. Tony refuses his evening dose of haloperidol, Haldol, then becomes extremely agitated in the dayroom while other clients are watching television. He begins cursing and throwing furniture. Nurse Oliver's first action is to A. Check the client's medical record for an order for an as-needed IM dose of medication for agitation. B. Place the client in full leather restraints. C. Call the attending physician and report the behavior. D. Remove all other clients from the dayroom. Answer is D. Remove all other clients from the dayroom. Junal, who is manic, but not yet on medication, comes to the drug treatment center. The nurse would not let this client join the group session because A. The client is disruptive. B. The client is harmful to self. C. The client is harmful to others. D. The client needs to be on medication first. Answer is A. The client is disruptive. David, an adolescent boy, was admitted for substance abuse and hallucinations. The client's mother asks Nurse Armando to talk with his husband when he arrives at the hospital. The mother says that she is afraid of what the father might say to the boy. The most appropriate nursing intervention would be to A. Inform the mother that she and the father can work through this problem themselves. B. Refer the mother to the hospital's social worker. C. Agree to talk with the mother and the father together. D. Suggest that the father and son work things out. Answer is C. Agree to talk with the mother and the father together. What is Nurse John likely to note in a male client being admitted for alcohol withdrawal? A. Perceptual disorders. B. Impending coma. C. Recent alcohol intake. D. Depression with mutism. Answer is A. Perceptual disorders. Ara has taken amitriptyline HCl, L level, for 3 days, but now complains that it doesn't help and refuses to take it. What should the nurse say or do? A. Withhold the drug. B. Record the client's response. C. Encourage the client to tell the doctor. D. Suggest that it takes a while before seeing the results. Answer is D. Suggest that it takes a while before seeing the results. David, an adolescent, has a history of truancy from school, running away from home and borrowing other people's things without their permission. The adolescent denies stealing, rationalizing instead that as long as no one was using the items, it was all right to borrow them. It is important for the nurse to understand this psychodynamically. This behavior may be largely attributed to a developmental defect related to the A. ID. B. Ego. C. Superego. D. Oedipal complex. Answer is C. Superego. In preparing a female client for electroconvulsive therapy, ECT, Nurse Michelle knows that succinylcholine, anectine, will be administered for which therapeutic effect? A. Short-acting anesthesia. B. Decreased oral and respiratory secretions. C. Skeletal muscle paralysis. D. Analgesia. Answer is C. Skeletal muscle paralysis. Nurse Gina is aware that the dietary implications for a client in manic phase of bipolar disorder is A. Serve the client a bowl of soup, buttered French bread, and apple slices. B. Increase calories, decrease fat and decrease protein. C. Give the client pieces of cut-up steak, carrots, and an apple. D. Increase calories, carbohydrates, and protein. Answer is D. Increase calories, carbohydrates, and protein. What parental behavior toward a child during an admission procedure should cause Nurse Ron to suspect child abuse? A. Flat affect. B. Expressing guilt. C. Acting overly solicitous toward the child. D. Ignoring the child. Answer is C. Acting overly solicitous toward the child. Nurse Lynette notices that a female client with obsessive-compulsive disorder washes her hands for long periods each day. How should the nurse respond to this compulsive behavior? A. By designating times during which the client can focus on the behavior. B. By urging the client to reduce the frequency of the behavior as rapidly as possible. C. By calling attention to or attempting to prevent the behavior. D. By discouraging the client from verbalizing anxieties. Answer is A. By designating times during which the client can focus on the behavior. After seeking help at an outpatient mental health clinic, Ruby, who was raped while walking her dog, is diagnosed with post-traumatic stress disorder, PTSD. 3 months later, Ruby returns to the clinic, complaining of fear, loss of control, and helpless feelings. Which nursing intervention is most appropriate for Ruby? A. Recommending a high-protein, low-fat diet. B. Giving sleep medication, as prescribed, to restore a normal sleep-wake cycle. C. Allowing the client time to heal. D. Exploring the meaning of the traumatic event with the client. Answer is D. Exploring the meaning of the traumatic event with the client. Meryl, age 19, is highly dependent on her parents and fears leaving home to go away to college. Shortly before the semester starts, she complains that her legs are paralyzed and is rushed to the emergency department. When physical examination rules out a physical cause for her paralysis, the physician admits her to the psychiatric unit where she is diagnosed with conversion disorder. Meryl asks the nurse, "Why has this happened to me?" What is the nurse's best response? A. You've developed this paralysis so you can stay with your parents. You must deal with this conflict if you want to walk again. B. It must be awful not to be able to move your legs. You may feel better if you realize the problem is psychological, not physical. C. Your problem is real but there is no physical basis for it. We'll work on what is going on in your life to find out why it's happened. D. It isn't uncommon for someone with your personality to develop a conversion disorder during times of stress. Answer is C. Your problem is real but there is no physical basis for it. We'll work on what is going on in your life to find out why it's happened. Nurse Kreina knows that the following drugs have been known to be effective in treating obsessive-compulsive disorder, OCD. A. Benztropine, cogentin, and diphenhydramine, Benadryl. B. Chlordiazepoxide, Librium, and diazepam, Valium. C. Fluvoxamine, Luvox, and clomipramine, Anafranil. D. Valproex, Depakote, and lithium, Lithobid. Answer is C. Fluvoxamine, Luvox, and clomipramine, Anafranil. Alfred was newly diagnosed with anxiety disorder. The physician prescribed buspirone, Buspir. The nurse is aware that the teaching instructions for newly prescribed buspirone should include which of the following? A. A warning about the drug's delayed therapeutic effect, which is from 14 to 30 days. B. A warning about the incidence of neuroleptic malignant syndrome, NMS. C. A reminder of the need to schedule blood work in 1 week to check blood levels of the drug. D. A warning that immediate sedation can occur with a resultant drop in pulse. Answer is A. A warning about the drug's delayed therapeutic effect, which is from 14 to 30 days. Richard with agoraphobia has been symptom-free for 4 months. Classic signs and symptoms of phobias include A. Insomnia and an inability to concentrate. B. Severe anxiety and fear. C. Depression and weight loss. D. Withdrawal and failure to distinguish reality from fantasy. Answer is B. Severe anxiety and fear. Which medications have been found to help reduce or eliminate panic attacks? A. Antidepressants. B. Anticholinergics. C. Antipsychotics. D. Mood stabilizers. Answer is A. Antidepressants. A client seeks care because she feels depressed and has gained weight. To treat her atypical depression, the physician prescribes tranylcypromine sulfate, Parnate, 10 mg by mouth twice per day. When this drug is used to treat atypical depression, what is its onset of action? A. 1 to 2 days. B. 3 to 5 days. C. 6 to 8 days. D. 10 to 14 days. Answer is B. 3 to 5 days. A 65-years-old client is in the first stage of Alzheimer's disease. Nurse Patricia should plan to focus this client's care on A. Offering nourishing finger foods to help maintain the client's nutritional status. B. Providing emotional support and individual counseling. C. Monitoring the client to prevent minor illnesses from turning into major problems. D. Suggesting new activities for the client and family to do together. Answer is B. Providing emotional support and individual counseling. The nurse is assessing a client who has just been admitted to the emergency department. Which signs would suggest an overdose of an anti-anxiety agent? A. Combativeness, sweating, and confusion. B. Agitation, hyperactivity, and grandiose ideation. C. Emotional lability, euphoria, and impaired memory. D. Suspiciousness, dilated pupils, and increased blood pressure. Answer is C. Emotional lability, euphoria, and impaired memory. The nurse is caring for a client diagnosed with an antisocial personality disorder. The client has a history of fighting, cruelty to animals, and stealing. Which of the following traits would the nurse be most likely to uncover during the assessment? A. History of gainful employment. B. Frequent expression of guilt regarding antisocial behavior. C. Demonstrated ability to maintain close, stable relationships. D. A low tolerance for frustration. Answer is D. A low tolerance for frustration. Nurse Amy is providing care for a male client undergoing opiate withdrawal. Opiate withdrawal causes severe physical discomfort and can be life-threatening. To minimize these effects, opiate users are commonly detoxified with A. Barbiturates. B. Amphetamines. C. Methadone. D. Benzodiazepines. Answer is C. Methadone. Nurse Christina is caring for a client who experiences false sensory perceptions with no basis in reality. These perceptions are known as A. Delusions. B. Hallucinations. C. Loose associations. D. Neologisms. Answer is B. Hallucinations. Nurse Marco is developing a plan of care for a client with anorexia nervosa. Which action should the nurse include in the plan? A. Restricts visits with the family and friends until the client begins to eat. B. Provide privacy during meals. C. Set up a strict eating plan for the client. D. Encourage the client to exercise, which will reduce her anxiety. Answer is C. Set up a strict eating plan for the client. Tim is admitted with a diagnosis of delusions of grandeur. The nurse is aware that this diagnosis reflects a belief that one is A. Highly important or famous. B. Being persecuted. C. Connected to events unrelated to oneself. D. Responsible for the evil in the world. Answer is A. Highly important or famous. Nurse Jen is caring for a male client with manic depression. The plan of care for a client in a manic state would include A. Offering high-calorie meals and strongly encouraging the client to finish all food. B. Insisting that the client remain active through the day so that he'll sleep at night. C. Allowing the client to exhibit hyperactive, demanding, manipulative behavior without setting limits. D. Listening attentively with a neutral attitude and avoiding power struggles. Answer is D. Listening attentively with a neutral attitude and avoiding power struggles. Ramon is admitted for detoxification after a cocaine overdose. The client tells the nurse that he frequently uses cocaine but that he can control his use if he chooses. Which coping mechanism is he using? A. Withdrawal. B. Logical thinking. C. Repression. D. Denial. Answer is D. Denial. Richard is admitted with a diagnosis of schizotypal personality disorder. Which signs would this client exhibit during social situations? A. Aggressive behavior. B. Paranoid thoughts. C. Emotional affect. D. Independence needs. Answer is B. Paranoid thoughts. Nurse Mickey is caring for a client diagnosed with bulimia. The most appropriate initial goal for a client diagnosed with bulimia is to A. Avoid shopping for large amounts of food. B. Control eating impulses. C. Identify anxiety-causing situations. D. Eat only 3 meals per day. Answer is C. Identify anxiety-causing situations. Rudolph is admitted for an overdose of amphetamines. When assessing the client, the nurse should expect to see A. Tension and irritability. B. Slow pulse. C. Hypotension. D. Constipation. Answer is A. Tension and irritability. Nicholas is experiencing hallucinations and tells the nurse, "The voices are telling me I'm no good." The client asks if the nurse hears the voices. The most appropriate response by the nurse would be A. It is the voice of your conscience, which only you can control. B. No, I do not hear your voices, but I believe you can hear them. C. The voices are coming from within you and only you can hear them. D. Oh, the voices are a symptom of your illness, don't pay any attention to them. Answer is B. No, I do not hear your voices, but I believe you can hear them. The nurse is aware that the side effect of electroconvulsive therapy that a client may experience. A. Loss of appetite. B. Postural hypotension. C. Confusion for a time after treatment. D. Complete loss of memory for a time. Answer is C. Confusion for a time after treatment. A dying male client gradually moves toward resolution of feelings regarding impending death. Basing care on the theory of Kubler-Ross, Nurse Trish plans to use nonverbal interventions when assessment reveals that the client is in the A. Anger stage. B. Denial stage. C. Bargaining stage. D. Acceptance stage. Answer is D. Acceptance stage. The outcome that is unrelated to a crisis state is A. Learning more constructive coping skills. B. Decompensation to a lower level of functioning. C. Adaptation and a return to a prior level of functioning. D. A higher level of anxiety continuing for more than 3 months. Answer is D. A higher level of anxiety continuing for more than 3 months. Miranda, a psychiatric client is to be discharged with orders for haloperidol, Haldol, therapy. When developing a teaching plan for discharge, the nurse should include cautioning the client against A. Driving at night. B. Staying in the sun. C. Ingesting wines and cheeses. D. Taking medications containing aspirin. Answer is B. Staying in the sun. Jen, a nursing student is anxious about the upcoming board examination but is able to study intently and does not become distracted by a roommate's talking and loud music. The student's ability to ignore distractions and to focus on studying demonstrates A. Mild level anxiety. B. Panic level anxiety. C. Severe level anxiety. D. Moderate level anxiety. Answer is D. Moderate level anxiety. When assessing a premorbid personality characteristics of a client with a major depression, it would be unusual for the nurse to find that this client demonstrated A. Rigidity. B. Stubbornness. C. Diverse interest. D. Over-meticulousness. Answer is C. Diverse interest. Nurse Kreiner recognizes that the suicidal risk for depressed client is greatest. A. As their depression begins to improve. B. When their depression is most severe. C. Before any type of treatment is started. D. As they lose interest in the environment. Answer is A. As their depression begins to improve. Nurse Kate would expect that a client with vascular dementia would experience A. Loss of remote memory related to anoxia. B. Loss of abstract thinking related to emotional state. C. Inability to concentrate related to decreased stimuli. D. Disturbance in recalling recent events related to cerebral hypoxia. Answer is D. Disturbance in recalling recent events related to cerebral hypoxia. Josephina is to be discharged on a regimen of lithium carbonate. In the teaching plan for discharge, the nurse should include A. Advising the client to watch the diet carefully. B. Suggesting that the client take the pills with milk. C. Reminding the client that a CBC must be done once a month. D. Encouraging the client to have blood levels checked as ordered. Answer is D. Encouraging the client to have blood levels checked as ordered. The psychiatrist orders lithium carbonate 600 mg P.O.T.I.D for a female client. Nurse Katrina would be aware that the teaching about the side effects of this drug were understood when the client state, I will call my doctor immediately if I notice any A. Sensitivity to bright light or sun. B. Fine hand tremors or slurred speech. C. Sexual dysfunction or breast enlargement. D. Inability to urinate or difficulty when urinating. Answer is B. Fine hand tremors or slurred speech. Nurse Mylene recognizes that the most important factor necessary for the establishment of trust in a critical care area is A. Privacy. B. Respect. C. Empathy. D. Presence. Answer is D. Presence. When establishing an initial nurse-client relationship, Nurse Hazel should explore with the client the A. Client's perception of the presenting problem. B. Occurrence of fantasies the client may experience. C. Details of any ritualistic acts carried out by the client. D. Client's feelings when external controls are instituted. Answer is A. Client's perception of the presenting problem. Tranylcypromine sulfate, Parnate, is prescribed for a depressed client who has not responded to the tricyclic antidepressants. After teaching the client about the medication, Nurse Marion evaluates that learning has occurred when the client states, "I will avoid A. citrus fruit, tuna, and yellow vegetables. B. chocolate milk, aged cheese, and yogurt. C. green leafy vegetables, chicken, and milk. D. whole grains, red meats, and carbonated soda." Answer is B. chocolate milk, aged cheese, and yogurt. Nurse John is aware that most crisis situations should resolve in about A. 1 to 2 weeks. B. 4 to 6 weeks. C. 4 to 6 months. D. 6 to 12 months. Answer is B. 4 to 6 weeks. Nurse Judy knows that statistics show that in adolescent suicidal behavior, A. females use more dramatic methods than males. B. males account for more attempts than do females. C. females talk more about suicide before attempting it. D. males are more likely to use lethal methods than are females. Answer is D. males are more likely to use lethal methods than are females. David with paranoid schizophrenia repeatedly uses profanity during an activity therapy session. Which response by the nurse would be most appropriate? A. Your behavior won't be tolerated. Go to your room immediately. B. You're just doing this to get back at me for making you come to therapy. C. Your cursing is interrupting the activity. Take time out in your room for 10 minutes. D. I'm disappointed in you. You can't control yourself even for a few minutes. Answer is C. Your cursing is interrupting the activity. Take time out in your room for 10 minutes. Nurse Maureen knows that the non-antipsychotic medication used to treat some clients with schizoaffective disorder is A. phenelzine, Nardil. B. chlordiazepoxide, Librium. C. lithium carbonate, Lethine. D. imipramine, Tofranil. Answer is C. lithium carbonate, Lethine. Which information is most important for the nurse Trinity to include in a teaching plan for a male schizophrenic client taking clozapine, Clozaril? A. Monthly blood tests will be necessary. B. Report a sore throat or fever to the physician immediately. C. Blood pressure must be monitored for hypertension. D. Stop the medication when symptoms subside. Answer is B. Report a sore throat or fever to the physician immediately. Ricky with chronic schizophrenia takes neuroleptic medication and is admitted to the psychiatric unit. Nursing assessment reveals rigidity, fever, hypertension, and diaphoresis. These findings suggest which life-threatening reaction? A. Tardive dyskinesia. B. Dystonia. C. Neuroleptic malignant syndrome. D. Akathisia. Answer is C. Neuroleptic malignant syndrome. Sophia is diagnosed with amphetamine psychosis and was admitted to the emergency room. Nurse Ronald would most likely prepare to administer which of the following medication? A. Librium. B. Valium. C. Ativan. D. Haldol. Answer is D. Haldol. Which of the following liquids would Nurse Lang administer to a female client who is intoxicated with phencyclidine, PCP, to hasten excretion of the chemical? A. Shake. B. Tea. C. Cranberry juice. D. Grape juice. Answer is C. Cranberry juice. When developing a plan of care for a female client with acute stress disorder who lost her sister in a car accident, which of the following would the nurse expect to initiate? A. Facilitating progressive review of the accident and its consequences. B. Postponing discussion of the accident until the client brings it up. C. Telling the client to avoid details of the accident. D. Helping the client to evaluate her sister's behavior. Answer is A. Facilitating progressive review of the accident and its consequences. The nursing assistant tells Nurse Ronald that the client is not in the dining room for lunch. Nurse Ronald would direct the nursing assistant to do which of the following? A. Tell the client he'll need to wait until supper to eat if he misses lunch. B. Invite the client to lunch and accompany him to the dining room. C. Inform the client that he has 10 minutes to get to the dining room for lunch. D. Take the client a lunch tray and let the client eat in his room. Answer is B. Invite the client to lunch and accompany him to the dining room. The initial nursing intervention for the significant others during shock phase of a grief reaction should be focused on A. Presenting the full reality of the loss of the individuals. B. Directing the individual's activities at this time. C. Staying with the individuals involved. D. Mobilizing the individual's support system. Answer is C. Staying with the individuals involved. Joy's stream of consciousness is occupied exclusively with thoughts of her father's death. Nurse Ronald should plan to help Joy through this stage of grieving, which is known as A. Shock and disbelief. B. Developing awareness. C. Resolving the loss. D. Restitution. Answer is C. Resolving the loss. When taking a health history from a female client who has a moderate level of cognitive impairment due to dementia, the nurse would expect to note the presence of A. Accentuated premorbid traits. B. Enhance intelligence. C. Increased inhibitions. D. Hypervigilance. Answer is A. Accentuated premorbid traits. What is the priority care for a client with dementia resulting from AIDS? A. Planning for remotivation therapy. B. Arranging for long-term custodial care. C. Providing basic intellectual stimulation. D. Assessing pain frequently. Answer is C. Providing basic intellectual stimulation. Jerome, who has an eating disorder, often exhibits similar symptoms. Nurse LeHay would expect an adolescent client with anorexia to exhibit A. Affective instability. B. Disheveled, unkempt physical appearance. C. Depersonalization and derealization. D. Repetitive motor mechanisms. Answer is A. Affective instability. The primary nursing diagnosis for a female client with a medical diagnosis of major depression would be A. Situational low self-esteem related to altered role. B. Powerlessness related to the loss of idealized self. C. Spiritual distress related to depression. D. Impaired verbal communication related to depression. Answer is D. Impaired verbal communication related to depression.